About 45% of all COVID-19 deaths in Oklahoma involve residents or workers in nursing homes. And because of that, friends and family are still not allowed to visit their loved ones face to face and provide comfort, even if both parties are virus free. One lawmaker in Poto says it's time for that to change.
Guess what? There are a lot of kids that will never get to see their parents again because they cannot get in at all.
State Representative Lundy Kiger has written a letter to Governor Stitt urging him to relax rules prohibiting outside visitors at nursing homes and long-term care facilities.
I don't want to open up the doors and run up and down the halls and be able to go in the room. When I say a soft opening, I'm talking about the possibility of having, the loved one either brought outside, which would be fine, or brought to the foyer area where it's big, where the family member can walk in maybe 8 or 10 feet away and for the first time lay eyes on them and be able to have a conversation and see how they're doing.
And that kind of interaction can have a very important therapeutic effect.
Whitney Bryen with Oklahoma Watch, from the people you've talked to, people who run these facilities, people that are living in them, what's your take on the representative's idea of a soft opening in some of these long-term care facilities?
When I started reporting that story, to be totally honest, I thought everyone was going to say, no way, that's crazy. We should not be reopening. But what I heard were, a kind of a 50-50 split. On one hand, it is the hardest hit group in our state and the most vulnerable. On the other hand, I also am hearing from families and even a couple of nursing homes that have had bad outbreaks that they think doing a soft opening, something that has a lot of restrictions attached, PPE, mandatory for everyone coming in, checking for fever and other symptoms, things like that, is a great idea.
The governor has ordered that all 308 long-term care facilities be sanitized, a huge task being carried out by 11 strike teams from the Oklahoma National Guard. In addition, everyone who lives or works in these facilities will be tested. As of Monday, the governor said about 35% of them had received a swab or saliva test.
So, Whitney, we really have to weigh some of these folks suffering from dementia. They're lonely, they're confused, and they're without their loved ones for 2 months. Weigh that against the virus and the potential to catch it and realize that both of those things can be life-threatening.
Last week, I spoke with Jeannie Ollinger. She lives in Oklahoma City, and she actually has 2 family members in nursing homes right now. Now, her aunt, who's at Grace in Norman, she was tested and positive for COVID-19. She had that diagnosis about 3 weeks ago and has had no symptoms of the virus so far. So her aunt doesn't understand that she's positive for this virus. And of course, she's not sick. She's not feeling the symptoms of it. So what she's experiencing is confusion when her niece, Jeannie, is calling her on video chat to talk to her instead of going physically to visit. She doesn't understand why Jeannie can't come and see her.
As of Monday, there are 1,053 confirmed cases in long-term care facilities.
What the state is releasing are daily totals, cumulative totals for every facility. In some cases, it is continuing to spread at nursing homes, and in other cases, it looks like it might be flattening out at specific facilities. And as of Tuesday evening, the death count was at 129 deaths.
There is clearly risk involved in a soft reopening of nursing homes. The question remains, how much and who decides if it's worth that risk?
I talked to one lady that sent me a message, and we talked on Messenger. She said April 16th. She said my mother got bad and she couldn't go. And she was there by herself in the hospital, and she passed away, and I never got to see her. I never got to have, closure with her at all.